Hello, I'm Lindsay Miner, Recovery Care Coordinator with St. Francis Way Clinic, and I'm here today interviewing Donna Rasmussen.
I'm Donna Rasmussen. I'm a physician assistant. I've been working at Macoupin County Public Health for 10 years with a subspecialty in substance use disorder and opioid use disorder management.
Thank you, Donna. Thank you for joining us. I just have a few questions for you on medicated assisted recovery.
Sure.
First is, what is the most important thing you'd like people to know about medicated assisted recovery?
The most important thing is that recovery is possible and medications are available to help people with recovery. Medications are not the only answer, but they are a part of the answer that can really help to decrease cravings for illicit substances, specifically opiates, for example, or alcohol. And then when you combine that medication with other therapeutic approaches, people can heal and get better.
And what are the types of medication used to assist in recovery? If you could briefly explain their benefits and risks.
Sure. For opioid use disorder specifically, there are 3 FDA medications that are approved as a treatment option. One is called Vivitrol, which is a complete agonist, meaning it goes into the brain and it completely blocks the receptors on the brain where an opioid would go. So that's one option. A second option is buprenorphine. That's the option we use most frequently at our clinic. It's called a partial agonist, meaning it goes into the brain where that opioid would normally sit, and it really helps effectively decrease cravings for opiates, and it also keeps people out of withdrawal. The third medication option that's FDA approved is methadone. Methadone is a full agonist, and it requires people to go to a specially licensed clinic to get that medication. So it can be very effective, especially for people that did not have a good response to one of the other 2 medications I mentioned, but it definitely requires a level of commitment because you do have to travel to a specific methadone clinic.
And in your opinion, Donna, how do those different medications help people stay on track with their recovery?
The most important things the medications do when they're working in the right setting is they decrease cravings for a particular substance. One of the substance use disorders we work with most frequently is opiate use disorder. So the medication decreases cravings for the opiate, and it also keeps a person out of physical withdrawal. And by doing so, that allows for brain chemistry stabilization, and a person can then start to focus on what else do I need to do in order to heal? For example, how do I stay away from the people, places, and things that trigger me to use? And that's an important part of the healing process. So there's a behavioral element, changing our behaviors to support our recovery. And then when we have it available, a medication element that helps the brain focus so those behavioral accomplishments can be realized.
In your view, Donna, how is therapy and medication used together more effective, and how do you explain that to your patients?
I explain it to my patients by saying a medication on its own can be very helpful. Therapy on its own can be very helpful, but medication and therapy combined together typically help people reach their goals faster. So again, the medication really helps decrease cravings, helps keep a person out of withdrawal, and I'm speaking specifically to opioid use disorder medications, and then in doing so stabilizes brain chemistry. Then if we're doing a full court press with therapy, we address behavioral changes that help support a person's recovery and help them meet their goals.
And Donna, how do you dispel the myth that using medication for recovery is just replacing one drug with another?
Well, the medication that are FDA approved for opioid use disorder, for example, you have to remember this is a behavioral health condition that we're dealing with, opioid use disorder. So the medicine helps a person change their behaviors. So if a person gets stabilized on medication such as buprenorphine, and that helps them to not have cravings for opiates, and they are no longer engaging in potentially danger or risky behaviors in order to go get that opiate to keep themselves out of withdrawal, that helps them take steps towards recovery.
Donna, can you tell me what are the biggest myths on people with opioid use disorder?
You bet. People with opioid use disorder have a chronic illness. And so one myth out there is that opioid use disorder is a character flaw in a person, or a lack of willpower, or a lack of self-control. That is not the case. This is a chronic medical illness, and it is incredibly treatable. And so, a big myth to dispel is people I often hear say, well, that's their choice. Using opioids is their choice. And I promise you, if it were a choice, no one would have opioid use disorder. So I want people to understand it's a treatable medical condition, and people can get better.
Thank you, Donna.